today to join us on our conversation on the COVID-19. I have some colleagues of mine today who are going to introduce themselves, and we also have a panel because, as you all know, we've all been impacted by the COVID one way or another. So we want to try and discuss and to try and understand what's happening, especially now that we have so much talk about the vaccine and so many people have so many questions. So I will let my colleague Yakil introduce himself.
All right, so good afternoon, everyone. My name is Yakil, also known as Luc Kangele. I'm a coordinator within the Congolese Action Youth Platform. And we also have Sly with us. But we will start with the guest that we have for this evening, this conversation we have about the COVID-19 in a Congolese community of the UK. So I will introduce the various guests that we have on the panel. We have Dr. Pedange Tampa. There is also Ms. Francine Kwaya, Fleury Litoki, Dr. Karim Prince Chibangu, Francos Nchipuki, and Oja Maya, who is a Congolese activist. And what we also have to stress is that this conversation will be held in English. And for those who are on the Voice of Congo and speaking French and Lingala, there will also be another conversation at a later date.
Donc, comme mon collègue vient de l'expliquer, pour ceux qui ne parlent pas l'anglais, nous aurons une autre conversation qui sera en français et en lingala dans les semaines à suivre. Donc, nous allons faire en sorte de l'organiser pour que tout le monde puisse vraiment comprendre ce qui s'est passé aujourd'hui et puisse avoir des informations. Merci. So I'm going to start, I think. And the first person I wanted to ask a question to was Maya. Hi, Maya. Well, as a young Congolese lady who lives in the UK, I know you're an activist and you have a strong voice in the community. What is your stand when it comes to the COVID? How have you been living it? What is your experience with it?
Bonjour tout le monde. I'm going to try and speak in all the languages just to kind of help the conversation flow. I think just as much as everyone else, exactly Lokomoko, we didn't expect at all. And how it kind of shook everyone's sense of reality, something that I think a lot of people had to cope with. I'm an activist, but I'm also an event organizer. So this had completely shut down a very big part of my activities in life, and also like a way of living, my income. So it's ça qui fait que luka ba moi mususu ya ko vivre en fait. But that wasn't necessarily the main objective. It was, I think, staying alive for March was like the main kind of thing for everyone, just kind of was without falling ill, but also as time went on, there were a lot of other things that started to kind of cloud the judgment of, Makame Tobaki Komona online. It's not a surprise. I'm not the only one that's been watching the news. I've stopped watching the news now, to be honest. And then Makame Banaki from March up until now, with how the media was pumping so much news on death, and I felt like it started to kind of impact us in lots of different ways that wasn't so healthy. So from the internet as much as I could, and also television. The Monarchy media was starting to play another big factor in our mental health that wasn't so healthy. So questions and because the news wasn't so it didn't feel so trustworthy comme normal, but social media, and social media so everyone gets to start expressing their views and opinions. And from there, we found ourselves in a place where we have a lot of doubt. Quite rightfully so, we have a lot of doubt towards what is actually going on, how it's impacting people. Après ça, la kapeke is all cloud judgment and solution. So I think from where I am now, I think my best saving grace, thank God I haven't been affected by COVID personally, or my family, but I know people in our community that have either lost their lives or that have been impacted with family members that were ill. And trying to keep calm and level-headed was probably one of the best things that I tried to do. I felt like it was very important to reduce the concept of fear from them, and also just to keep them their normal regulations and about my medicine and also for me sure that as one of the people in the house that was less vulnerable to kind of protect myself as well from what was out there. The main I think is that we had to find a way to stay calm. So that's kind of what I've been trying to do. I guess mental health is actually as well. I think that's something that people don't really speak about. The virus or COVID became for me more than just the virus that was put out there. It became mental health issues, but that neglected. There were so many reasons to why Batubele lost their lives. So, that's kind of why I kind of stepped back from throwing my perception out too much and just receiving fear is kind of what my main issue was.
Thanks very much for sharing your views, and you stress on so many points which are important, because it's true with the COVID, it's not physical. That's what people need to remember. It can become very mental as well. As a health professional, I had moments of anxiety myself, and I was just like, couldn't recognize myself. So yes, it does affect us in so many more ways. Donc, on réalise pas nécessairement, mais ça peut nous affecter à tellement de niveaux. C'est pas seulement physique. Donc, il faut s'en rappeler. Il faut pouvoir avoir des gens à qui on peut parler quand on commence à avoir des anxiétés ou quoi que ce soit. Donc, ne pas avoir peur de s'exprimer, en fait. Merci vraiment pour ton témoignage.
Juste comme susupona Nekomaya, in your own experience, I mean, within this time, have you been able to go out or speak out to other people who really have felt it hard with what's been going with COVID-19?
Yeah, like I said, I had one of my closest family friends, Papa Francis, one of my mom's close friends and videographer for the show that she used to do. He passed away, and that hit the family really hard. There were other people that I know, family members that had people declared, that they passed away from COVID. There was a lot of speculations as well regarding their death certificates and how they actually died. And I think that was another reason why it made it harder to really understand what was going on. Parce que ezaki oyoki mutakufi me baomuko babaki ke non franchement azaki na COVID me bakomi kazaki na COVID. And I think stuff like that started to make me feel more frightened of what was genuinely going on. Parce que bien sûr bazaki ko, people were genuinely affected by this virus that we're hearing. To what extent, and to what extent were people's lives being put at risk and tampered with as well? That became scary. Because the reality was, but there's an idea, and that's something that's very scary to kind of process, especially for Congolese and Abisso. Na language barrier is that on the news in English. It kind of starts to have an impact on like the fear of even going to hospital. So it then became scarier because it was close to home. Not necessarily because it was just musika. So that became scary for me as well.
Thank you, Sister Maya. We also have another guest with us. I will introduce him before asking the question to this gentleman. He is known as a serial entrepreneur within the community, and he is also put together Voice of Congo and various other platforms as well. And he's been organizing various events in the United Kingdom, I would say. And I'm talking about the one and only Francos Chimpuki. Bonsoir. Francos.
mute. Bonsoir, bonsoir, bonsoir.
OK. Merci d'être avec nous dans Pourquoi Lelo. So, as a rather young and athletic individual, I know that, on Instagram, I'm seeing kind of your fit gentleman. So, what could you tell us, knowing what you have recently, like, I'm happy that you see you're healthy. So, and I thank God. I know that you've contracted COVID-19 and you have survived. And so, what is your personal experience with it? So is but the next question will come after.
First and foremost, obviously, you only know it affected me physically. It started from the beginning. When it all started, it affected my business. So I'm into the event business. I also have a studio. I wasn't able to, we haven't been able to organize events like we do every year. The studio is been open, shut, open, shut, open, shut. And there hasn't been a consistent flow of customers because customers are staying home because they want to keep themselves safe. We even refurbished the studio, but we're still not able to get customers and we're still paying the rent every month. You're paying the rent, you're paying the bills that comes with it, but you're not able to use the facility. That alone has been a huge financial burden on me in terms of mental health. That's not a good thing. So I had to really look at my finances and try and say, okay, how can I make more income probably online and how can I reduce some of my expenses? And I ended up getting a second job in the evening just to surplus my income. At the same time, I was trying to do some activities online to generate more income. And I really believe that the job that I got, because I was working as a supervisor of a security team at a bar. And that bar, we get thousands and thousands of customers. So they just come there to drink. And sometimes people come and hug you when you don't need them to hug you. And all that things, for me, it didn't process because I've been very wary of COVID from the beginning. Like the people that follow me on Facebook or Instagram, they know that I always talk about protecting yourself, doing this, doing that. It never crossed my mind that one day I was gonna catch COVID. So on the 12th of December, I was coming from the second job and I was just really tired, really tired. And my partner told me, why are you looking so tired? What's wrong? I was like, probably because I went to the gym in the morning, then I worked on Voice of Congo during the day, and in the evening I can't see what's gonna happen. The following day, I woke up in the morning and I was just sweating on my stomach. I was sweating and feeling a lot more tired than the day before. And I didn't think anything of it. I was like, oh, probably just a tiredness. Let me go to this job because they gave me an early shift at that job. So I went to that job during that day. I mean, it was the craziest day I had in my life. When I had all the symptoms, but I still managed to pull through to 11 p.m. in order for me to get back home. So when I got back home, I said to myself, back that Monday, which was the 14th, I said to myself, if I don't feel well, I'm not getting in. So on that morning, I woke up, I was mashed up. What I mean, I was mashed up. And that was it was the minimal symptoms. Like I didn't even know at that time that was the least symptom I could have. I felt like at that time, I had some type of flu. I was just feeling pain everywhere. And I started to cough. So it was a small type of cough. And then noticed that I lost the taste of food. So I wasn't able to taste any food, but I was able to smell. So I decided to phone the actual owner of the security company. I told him I'm not coming in, and I told him all my symptoms. And he was like, what are you telling me sounds like COVID? Go and test yourself. I was reluctant, but at the same time, I said to myself, okay, I exposed myself in the last few days to a lot of people. I had my son, my partner, like everyone else that came across me. I was like, whoa, they could have it if I have it. So let me check and see if I have it. So I went tested on Monday, and on Tuesday, the 15th, I got a text message in the email telling me that I was COVID positive. And me being a positive person, I was like, okay, I'm quite healthy, I'm quite young. It's just gonna hit me like a flu and then it's gonna go off. Bam. Following day after having my result, my cough started to increase. I was having a lot more aggressive cough. and I started to have this mucus that looked like, I don't know if you've seen coming from meat, like it was green and it was heavy. I started to have that mucus coming on a regular. I was like, wow, this is too much. I was coughing and I was having the mucus. I thought to myself, no, I can't work today. Let me go home. I went home, I had a shower, and I changed my clothes. I go in bed. I never came out that bed. I stayed in that bed for 3 weeks. Every day, my symptom was getting worse. Diarrhea. My eyes were hurting. My throat. I couldn't even breathe in fresh air. Every time I breathe in fresh air, it was so painful. I started to have lung pain. Like my lungs were hurting so much, I had to put Vicks on it. Even on my back, it was hurting so much, I couldn't sleep on my back anymore. I started to sleep on my tummy. And I also had muscle pain, joint pain. Like overall, my health started to deteriorate. I even had to get in touch with Dr. Pidange just to get some tips in order for me to be able, to know what to do in order to recover. So I called other people in the community that had COVID and were able to conquer for me to find out how did they do to get over that. When I'm in that 2 weeks, I had a fever that would not go away. The fever would not go away for a good 10 days. That fever was from 37 sometimes to 39. Constant fever. Every time I put a blanket over me, the bed gets wet. Every time I take it off, I feel cold, so cold. The cold was so intense. I was like, what am I going to do? So it was such a horrible experience. I ended up crying in that room about 3 times. There was 3 times where I was literally crying because I felt like I wasn't going to make it. Because my breathing started to be affected, but luckily enough, I had the oxygen, so I was checking my breathing, but it was still, my oxygen level, sorry, it was still from 95 to sometime we got to 98. So I was quite confident as long as my oxygen level was okay, I wasn't going to have to need to go to the hospital for me to be put on a ventilator or anything as such. But it was such a bad experience that I would not even wish it on anyone. It was such a bad negative experience. And I couldn't be, I did not believe. There was time I started doubting myself. I was like, am I going to make it? Because it became so serious. So on the 12th day when the fever went down, that's when my symptoms started to improve. Like the small symptom started to go with it. What stayed was because the cough, I used to have this cough. When I cough, my whole body would shake. So I'll be coughing for a good 2 minutes without stopping, and my body would be shaking, like a proper cough. And then another symptom that I had that was quite strong, apart from the cough and the fever, it was the pain that I was having on my lungs and breathing. Anytime I try and do any movement or any like short distance walk, I have that type of problem. Until now, I haven't been able to go back to exercising because every time I move or I do something drastic, I get the symptom, they'll come back in, but they won't be as aggressive as they were before. So I'll be having a lot of small cough. I'll be having a low breathing issue. So I'm trying to go back into exercising. So as also the seriousness of the actual virus and stuff. Because before, when I used to hear it, I was like, okay, this is serious. I'm seeing people dying. I'm reading about it. I'm researching it. But someone like me who exercise, I eat well, I don't drink, I don't smoke. For me to be affected, the ones affected, it made me question, what about the people that do drink? What about the people that do smoke? What about the people that do not take? And we really realized this is one of the reasons that a lot of people are dying from it. Because if your health is already affected by your lifestyle, then if COVID comes around, you don't have any chance. So for me, it was that experience. Luckily enough, my partner, my kids, none of them were affected. None of them were affected. They didn't have a positive test. And for me, that was a miracle. Because, like, for example, my partner, I was embracing it. the day before, I literally thought it was so. I was like, this virus is open now, but tu vois, comment est-ce que n'embrasser Moutou, hein, yeah, as you are it's all open now, and even Zach, the smallest kid, I was kissing him, and this guy didn't have it, but I had it, so I was like, maladie is a mystique, and if I started saying, this is demonic. But in all fairness, the disease is there, the virus is there, and people are getting. And my family alone, my dad had it, my older sister had it. My sister had a serious one. My dad also had a serious one. My dad didn't even tell us because he didn't want us to get alarmed, so he kept it to himself. My sister had it. I knew of it because she caught it in Kinshasa. As she was coming back to the airport, they did the test. She did not believe this at the airport because obviously in Kinshasa, so they did the test at the airport, but she did not believe it. She went to a private hospital, she paid money to get another test, and he confirmed that she had COVID. And then the symptom got worse and worse and worse and worse and worse as she stayed there. But luckily enough, she made it. I have another younger brother, he had it, but he was lucky, he had meal symptom. My older brother is in Holland, he had meal symptom as well. So our whole family, we saw, experienced him. Even my papa Kulutu, we were all scared because he had heart problems. He had quite a serious one, and he was coughing and he was having a lot of symptoms. But luckily enough, he's pulled through. So with COVID, that right now as I stand, nobody can tell COVID is like. So I even said to someone, because I've experienced it to a level where, you know, I felt like it was going to take my life. And if you come into me and having that type of conversation, because I'll see you like a danger to society. But that type of conversation or that type of discourse or speech, you're encouraging people to expose themselves to a danger. Literally, if not take their life, it can take the life of the loved one. Because some people, bazana COVID, bazana basemte. Mais ceux qui sont basimbi batumi susu, batumi susu ande bazo la affecté. Donc, Yangwana, for me, was important to even share my story on Facebook in order to collect about the danger. I lost 7 kilos in the space of 2 weeks. Like 2 weeks without exercising, even though I was still eating, my poids is okay. I even said to myself, so keen as I coliate. I perd attack 14, attack 15, parce que I need to eat in order to give my body enough like nutrient for it to fight the actual virus. Mais nazolia, nazokonda. And after the 3rd week, nakenda na matana ninya kilo, na longole la mba na mitala na bi, hey, Nzambe. So now I'm fighting to get my way back, but you know, God is good with me. I'm happy to be here. Now I'm gonna be no good to be. And when I'm hearing that, I'm speaking to people, I'm hearing that people are dying. I'm starting to realize, you know, great God has been to me. Oh, lobby na kindo mususa kufi. Na bengi su kutum su kisu ndeko oyo mama na ya kufa ki mama kende ko ede mama beli mama kufi. And it's like making me realize, wow, this is actually serious in the community. So that was experience with it's made me so give vaccine mean I was a vaccine. I was a vaccine. But look on money. But I go to website, tala vaccine what vaccine in order to protect myself pour à la calme. Mais na ebi que vaccin na ebi te pour protéger à 100%. I'm going to do that. Donc c'est un peu ça.
Ok, en tout cas, merci beaucoup. Au lobby mingi, donc au lobby penyonso. La question, on a un peu na ceux qui ont vaccin de sociaux au Yanoli na question nanga. Donc merci beaucoup. Et voilà quoi. Donc Carole, à toi.
Donc moi j'ai une question pour Toki. I know you're a lab technician, and really what we wanted to know really.
Yeah.
Obviously, COVID real has been answered because we've got people who have been affected, so we know it's actually real. But what is it really? How do you guys identify it? And how is it affecting you even in the workplace on a daily basis? Things must have changed so much.
Thank you so much. And as you said, my name Fleury Litoki. I'm a BMS, I'm a biomedical scientist. And what I'll say about COVID, yes, COVID, the coronavirus, it exists. and it has existed even before our existence. So there are so many types of coronavirus before this coronavirus. And this, you can tell it by just, looking at the name COVID-19, which means the 19 means the year that this coronavirus this outbreak started or was isolated. So that means there was other COVID before this that we have now. So just going back to the history, because this is our scientists' work, going back to the history, we had already coronavirus, from animals as well. And also, I can say with animal, we had maybe the first isolated sequence of coronavirus was 100 years ago. And the first human COVID was isolated in 1960, if I have a good memory about what I have researched. And what is coronavirus? Disease. So coronavirus, COVID-19, it is a disease, and it's a contagious disease. And this contagious disease is from a virus called severe acute respiratory severe acute respiratory syndrome. This is what we call SARS-CoV-2. And also you can tell by the name SARS-CoV-2 is the second SARS-CoV, the second sequence that they have found, which is very similar to the first one that was already isolated in 2013. So it's very similar. That's why we're calling it SARS-CoV-2. And also, looking at the virus was this virus, that the outbreak, it was discovered from a student who went to Wuhan, China. And going back to his country, he had symptoms, as what Francois just told us, and they had to diagnose the patient and also isolate it. And because they knew that the symptoms was very similar to, the influenza virus that we all know about it, the cold, the flu, and everything. But there was something very, very particular to it, which is a respiratory problem, and which doesn't really happen with the influenza. And this is how, because we have scientists have a bank of sequence, and when they collected this sequence, they matched it with other COVID sequence. It was very identical, and especially very identical to the COVID isolated in 2013. So how the second question was, how is it identified? So normally scientists use, at the moment we have 3 techniques that we're using. So the first one is the PCR, and the second one is the antigen, and the third one is the antibody technique. So the first one, PCR, is the reverse transcriptase chain reaction, which is a reaction of testing the RNA, because coronavirus itself is a single RNA, single stranded RNA. So what PCR does, first of all, it has 2 enzymes. Those enzymes are catalysts to speed up the reaction, as we all know from science. And the 2 enzymes, the first one is reverse transcriptase, and the second one is polymerase. And those enzymes, they amplify the RNA. So as soon as you take your swab, you give it to the scientist, and the PCR, what the PCR will do is to amplify the enzymes, the reverse transcriptase and the polymerase will amplify the sequence, multiply the sequence that you have, the RNA that they will find on the swab. And after that, there will be another reaction, as is a polymerase reaction, another reaction which in the PCR, we have things that we call primers, probes. Primers are, they can match the sequence, your sequence. So they will attach to your DNA and can match the sequence. And after that, there will be a detection. So the detection will tell scientists that if the sequence that was attached to was similar to the consensus sequence. The consensus sequence, I'll say, it was the first sequence that they discovered with the girl that was the Wuhan student. So this is the consensus sequence that all the scientists used, and that was back in 2019, December 2019, when they first discovered this COVID outbreak from Wuhan. And this is what we use in science, and this sequence is what we use as control sequence. So we have two things in the laboratory which we use. We use the accuracy and the precision just to make sure that this sequence is. So precision first is we're going to compare the RNA strand of the patient to the one of the detection that comes out of the PCR is similar to the one of the consensus sequence. This is what we call precision, and also work with accuracy just to make sure that the method that we're using is similar to the labs. So this is what we call accuracy, and I don't want to go to too many medical terms. We have IQC and EQA, things like that. So just to test that. And also, apart from the PCR, we have the antigen detection, which is, at the moment, is not really accurate in the way. This is the rapid test, COVID rapid test that we can see around everywhere now. You see people queuing up for the COVID rapid test, and if you go there, you register yourself, you'll get a result within an hour. So this antigen, what it does, it does not test the RNA, because the RNA is what we are looking for, because this is what is the sequence that we are looking for. And the antigen mostly test the protein, the antigen on the protein, because as we know, if your body comes in contact with the antigen, it will produce the antibodies. So this is what the antigen does, test does. So if you go, you see the antigen very, very easy. So, and also, it's just like a pregnancy test. You put something and you see it. So this is very similar, the similarity. And the third one is the antibody testing, which can be done with blood. This is just to know if the person already had COVID. And because if the person already had COVID, he had COVID in the past, his body will have antibodies already produced. And this is how the antibody will be tested, because they will know that your body can produce antibodies. Therefore, you had already contacted the virus. And I don't know if there is another question, or maybe if I wasn't clear, maybe I'll, yeah.
No, thank you. It was very helpful because you guided us the different tests. Donc, ça explique à peu près pourquoi there's different ways of finding it. Quite good. So I guess it can help people understand better why some people have the blood test, why some people have the PCR. We started with the PCR initially, and obviously we're evolving, and it's the reason probably that we have different tests that are coming out now. So yeah, so thank you very much for that. I think I'm going to get Yakil to go to the next question.
Yes, thank you, Carol. And so you're still on the Congolese Action Youth platform, COVID-19 conversation within the Congolese community. So our next guest speaker, it is Dr. Karim Chibangu. He is a doctor of telematics, so that is part of electrical and electronic engineering. And Dr. Karim Prince, he is also a lawyer. And the reason why we have him within our conversation, if you remember in the early days, I think last year around March, there was a few speculation about, hearsays about 5G, and that's why people were suffering. And and they were catching this COVID. We're now aware of so many other things was going on. We heard from Franco Sochipuki that is something that people experience died from. But Dr. Karim will tell us more about the correlation and talk about 5G. Dr. Karim Prince, can you hear me?
You're still on mute. You need to unmute yourself.
Yeah, thank you. Can you hear me?
We can now, yeah, thank you.
Yes.
Okay, thank you for having me.
I think it's the time for your presentation as well, so I'd get Sly to share the slides. What's your tool?
Okay, I've got it on my screen, PowerPoint.
Okay.
Okay. Now, this question has been asked many times, and every time you switch on YouTube, even my own daughter, she comes and says, "Oh, Daddy, I saw on TikTok, they're saying 5G is causing COVID, or 5G is interactive, the vaccine is a way of controlling people." Oh, I've lost my presentation.
No, Sly, I think you need to, you've actually, yeah, that's the one. Is that the one?
Yeah, so how do I scroll through? Because it's not moving.
Okay, I think it will be easier if you're the one sharing rather than sliding. Maybe that's why it's not moving.
Yeah, because now my screen is not completely blank. Okay, let me see if I can share it from here.
Hold on a minute. Try and see if you can share it now, Dr. Karim.
I can?
Yeah, try and see if you can. I've given you access to screen share.
Let me try. That's technology. I'll go share screen.
Yeah.
Okay. Okay, let me see. Is this my presentation? Let me see, share.
That's it.
Okay. So everyone will be able to follow this. Anyway, so basically, I don't know how to put it. It's quite difficult to try and explain to people the relation between electronics and biology, although sometimes they interact. So I'm going to do this presentation. There are three main parts people have to understand. So at the end of the presentation, they'll be able to draw their own conclusion, but it's going to be clear that there's no correlation. What is 5G? That's the first question. So before answering that question, we need to understand, although everybody by now is like G generation, so that is a 5th generation in a mobile telephony, but I'm gonna give a background to exactly technology works, because it's very important for people to understand first why they think it could interfere with their health. So the three aspects we need to understand. The first one is the electromagnetic spectrum. What do we mean by electromagnetic spectrum? So if electromagnetic spectrum did not exist, we wouldn't be able to see light. We can't hear anything. We won't be able to do anything at all, because we are surrounded by the electromagnetic spectrum. So what makes the difference? While we can hear the light, we can sound, we're going to have a look at that. Then we'll see effectively if 5G can interact with your biology. Also, you have to understand the difference when we say frequency and wavelength. What is the difference between the two? There's no difference. They both work together. So you can't have one without the other. So if you have a frequency, you're going to have a wavelength. This is a very, very important, because that's all the mobile telephone technology. In fact, everything that uses frequencies is determined, is defined in terms of wavelength. The next one is mobile phone technology and its relationship with the electromagnetic. So the slide you'll see means spectrum, what we call electromagnetic spectrum. The electromagnetic spectrum is divided in three parts. The first part is the audio spectrum, followed by the radio spectrum, and then the visible spectrum. Now, the audio spectrum, everybody will understand. This is when I speak and you can hear me. Those are the frequencies the human ear can actually hear. So when you go to test your hearing, when the babies are born, they try to test if they are deaf or not. So that's the testing spectrum, which goes from 20 hertz to 20,000 hertz, which is a kilohertz, 20 kilohertz. Now, further slides, let's see. Just give me a minute. Yes, okay. Now, I'm not gonna give a lecture in electronics, so you'll have to bear with me because there are a lot of technical terms, but there's no way around it. I've just used those terms because that's exact. And everybody knows these terms, even though most of the times they think they don't. So if you listen to a radio, you say, oh, I want to listen to capital FM. You turn your dial, you find capital FM on 100 megahertz. Or you look, no, that's Kiss FM is on 100 megahertz, capital FM is 95.8. So that megahertz, it just means is 100 megahertz is 100 million hertz. So without the tuning radio, you can't hear those frequencies. So you can't just sit like this with no radio, no, and then start hearing capital FM. No, it has to be modulated and then broadcast. That's you can hear that. So just to show you that the frequencies. So without any electronics, the human ear can only hear the frequencies between 20 hertz and 20 kilohertz. This is very important because from this now, there's a slide I'm going to put up. If you look at that green pie, that pie shows you exactly how the frequency spectrum, radio frequency spectrum is divided. You go from ELF, which is extremely low frequency, to EHF, which is extremely high frequency. Now, everything, now we're talking everything that you know, anything that is electronic. So your TV, your radio, your remote control, your car alarm, you know, your car alarm, your walkie-talkie, your anything that you can control a distance, they all use frequencies. So all those frequencies, they are within the spectrum. So when people tell you 5G can cause this, you'll have to ask yourself, all of these years, you've been using microwave oven, you've been using TV, radios, mobile phones. Why is it so different now? So the difference is going to be in terms of frequency. Now, low frequencies, nobody's complaining about that. Everybody thinks that we can live with low frequencies, but once you get to high frequencies, that's when it becomes a problem. And a lot of people who don't understand electronics, the minute they say, oh, 5G is not going to be broadcasting in a microwave band, they just say, that's it. It's going to kill everybody because it's in extremely high frequency. Now, we're going to see exactly why that is not true, okay? So the third spectrum is what we call the visible light spectrum, or simply light. Because people might be surprised, like sound and light are one thing. They're exactly the same. The sound and the light are all the same. The difference is just the frequency. So we had a look at how far the radio frequency, the range of the radio frequency is exactly now if you look on the slide, can people see the slide?
Yeah.
Okay. If you look at the slide, you'll see that the frequency for the light, visible light, is between 400 and 790 terahertz. So that's 790 trillion hertz, which in fact is higher than the frequency on which the 5G is going to be broadcast. So you're going to tell me the light can actually kill you? Is extremely high frequency, the light. Okay? Extremely high frequency. So hence, if you look at the red light, is about 400 to 580 terahertz. So every time you look at the color red, that's the frequency. If you look at color blue, it's got a different frequency. Because the light, without going too physical, the light that comes from the sun is a white light. So if you look at it, it's white light. So if you put it through prism, anyone who did basic physics, you'll see the light get divided in different colors. That's why when it rains and you look at water droplet, you see, what do you see?
Rainbow.
Rainbow. So the rainbow is just the light being divided into different frequencies. So you'll see start with red, blue, going up into the spectrum. The colors that you cannot see, the frequencies that we cannot see and we cannot hear. So for instance, once you go below red, we have infrared, which you cannot see, but you can feel as heat. So when you put your hands at your radiator or makala and motor, you're gonna feel the heat, but you're gonna see the source of the heat, but you're not gonna see the heat itself because it's invisible, because it's an infrared. So all those frequencies, and when you go above violet, we go into ultraviolet, which you can't see either. Now we understand this is the three separate spectrums. We have audio spectrum, radio spectrum, and visible light spectrum. Now let's see where the technology takes us. Frequency v wavelength. There's a simple formula which tells you that lambda, which is the wavelength, equals speed of light divided by frequency. Now, every machine, every technology that uses frequency uses that formula, okay? Lambda equals C, which is celerity or speed of light. Some people use V over F. It's still the same. It's just the speed of light divided by frequency. Now, because lambda is inversely proportional to frequency, the higher the frequency, the smaller the wavelength. So we talk about millimeter, nanometer wavelength, or meters and kilometers wavelength. So this is extremely important, and that's what determines the technology in the mobile phones. So for example, if you take a 15 hertz, which is a very low frequency, the wavelength will be 3,000 miles. While 300 gigahertz will give you only 1 millimeter range. 1 millimeter rather than 3,000 miles. Now, why is this so important? It is important because if you're broadcasting in a very high frequencies, you'll need to boost that signal by so much in order for it to reach long range. That's why, for instance, if you're listening to Capital FM in London, the minute you leave London, you start driving somewhere else, you're gonna lose it. But
what you're trying to tell us really, the strength of the 5G, there's no way it can actually deliver that kind of power and affect us. No, the reason, yeah, the reason I'm asking that is because we're going to run out of time and there's more slides.
Okay, yes. So let me just go quickly.
Okay.
Now, What happens then? Okay, let's pass the. So mobile phone technology, you'll have to understand that the technology is ancient. Mobile telephone did not start today. So from the 40s, we had the talkie-walkies, which were two-way radios. So I press hello, Oyokinga, and that was the end, Ayoki. In Congo, we call it Motorola. Motorola is just a brand name, okay? But because it's the most popular one, everybody calls it, I'm talking on a Motorola. Then they took it, they made them portable, and then they put them in the cars. Then what will happen is you'll call as a radio, it gets to the station, they convert it in another signal, it becomes like a telephone. So the technology existed. Now let's get to the, because the slide is there, everybody can have a look at it. So those two-way radios, that was the first generation mobile phone, or 1G, okay? So we moved from 1G and went to 2G, okay? The 2G was an improvement on 1G because now it became like phone to phone rather than having to call a base and then base call somewhere else. So it became, I can just phone you directly. So the advantages were like you could have just SMS messages, which did not exist before. So in 2G, you could send SMS messages and the like. Then we moved on to the third generation of mobile phones. These now, you can actually use internet on your mobile phone, okay? So that was the third generation. And the frequency was changing. So we were between 600 megahertz to 800 megahertz. So that was still 3G. Then we moved on to the fourth generation, which was an improvement on 3G simply because the speed was getting there. You could have live streaming, so you could watch like your TV show on a phone. You could do that. That didn't exist with 3G, so 4G brought that. Now, what's not the difference with 5G? 4G had a lot of shortcomings. So you can have your 4G at home, you connect to your Wi-Fi, it'll work fine. The minute you go out, the speed will drop with the quality. Sometimes you switch to 3G. So although 4G is really good, but the bandwidth was so small and the population is increasing worldwide. So we had to move to the next technology, which is 5G. Now, you can see 5G is divided in three parts where you have the low band, mid band, and high band. As I said, it all comes to the more frequency you have, the bandwidth, the more data you can pass through. So 5G uses just more data, is extremely high frequency, so you can actually divide it in tiny, tiny particles. So because it's trillions, it's much easier to have more data passing. So in short, with 5G, you'll be able to get exactly the speed equal to or higher than your cable broadband at home, your Sky, BT broadband. The 5G broadband on your mobile phone will be faster than what you've got at home. Now, because it's in a microwave range, it's extremely, extremely short wavelength. So you cannot broadcast it. In fact, you need mast in every, like 2 houses, 6 houses, you need a mobile phone mast because it can't broadcast and it's extremely low energy. Therefore, it cannot affect you at all. And whether it can interact with the vaccine, that is impossible. Also, anyone saying if 5G can cause COVID is like saying, remember, for 5G to cause COVID, COVID is a virus, which is a living organism. So just think about it. Just by broadcasting a microwave, you create something. It's just impossible, okay? So in short, 5G cannot cause and did not cause COVID. So there was another question you guys asked, if I can answer it in one go quickly. That is the legal side of it. Can I carry on?
Yes. Yes.
Okay. So the legal side of it, people ask if you can refuse to take a COVID vaccine. And secondly, the companies, because this is a question was asked, where they say no job, no job, correct?
No job, no job. No job, no job contract.
Okay. To start with, when you go, because PDANG vaccinate people, when you go any vaccine, first they're going to ask you for your consent. This is what people don't understand. It's not compulsory. In order for it to become compulsory, the government has to pass a law saying everyone from the age, let's say from 10 upwards, has to be vaccinated. They'll have to vote the law in a parliament, then that law can be enforced. So there's no law that requires you to be vaccinated. Therefore, it cannot be enforced. Now, go on.
So if you had an employer who actually told you, I would not employ you unless you've had the vaccine, where do you stand then in that sense?
Okay, that's good. Without the legislation, there are two scenarios, because what was asked is that people who already work for the company and people joining the company. So I'm gonna take the first part, people who already work for a company. I spent yesterday in employment tribunal by Zoom, okay, because someone was fired and they were claiming like it was unfair dismissal. Once you have a contract of employment, let's say you or me, we're already working for a company. We have to have a contract of employment. Those are the terms and conditions of your employment. So your employer said, you'd have to respect this and I'll pay you this much for your services. Now, that contract, in order for your employer to modify it, it has to be through consultation. So if they just change the terms of the contract, they're in the breach of contract. So you can sue them. So if your employer comes to you and say, oh, you don't have a COVID job, therefore you're gonna lose your job, you take them to employment tribunal, you win. Actually, no dispute, simply because those terms are not in your contract of employment.
Okay.
Now, if you are new and the company says, we have a policy, this must be advertised. The policy of this company, for obvious reasons, we're not going to employ anyone who's not COVID vaccinated. Now, remember, we are in absolute, that will be first, simply because there's never been a case where you have to be vaccinated. Nurses have to take certain jobs before they start the job because they interact with patients and stuff, and the doctors, they have to do that. But even that is not framed in law. Now, any employer asking you, like, you need a COVID job before we employ you is the same as telling you you have to be white, or you have to be tall, or you have to be short. It's still a discrimination because there's no law that says it has to be like that. Everything we do must be within the law. And so far, there's no legislation that says you need to have a vaccine in order to get a job. So any employer doing that, they're breaking the law, and you can actually sue them. So you can apply, if you see a company advertising, no job, no job, apply to that company, then tell them you're not going to get a job. Let them refuse you, then sue them. And they're going to lose because there's no legislation that says you need to be vaccinated in order to get a job. So that is totally arbitrary. So that's a short answer to that question.
Brilliant. Thank you very much, Dr. Karim Chibangu. That was very informational, and then is definitely what we needed, especially the last question to, squash all these hearsays and talks we hear from people. So thank you very much, Dr. Karim.
My pleasure.
Thank you. I mean, the next question is more to Dr. Tampa, and it's all about the vaccine. It's just for him to try and explain to us what the vaccine is and why in this country, for instance, we've actually been approved 3 different vaccines. So some people are wondering today, is there one more effective than the other one? Can you choose which vaccine you're going to have? Or if not, why is there 3 of them? So I'm going to let Dr. Tampa try and explain that to us. And obviously, we want to know if we can trust it, because in a long term, when it comes to the COVID vaccine, this is a new vaccine. So that's why people are so worried.
Okay, yeah, no problem. Can I share my screen?
Yeah, let me try and do that now. Hold on a minute. You should be able to now.
Okay, no problem. So let's go to here. Right, okay, so I'm just going to do a short presentation. It won't be very long. We'll hopefully go through it very quickly, and it will be informative. So, all right, this is my presentation. Can you guys see, can you see the presentation?
No, it hasn't come up on our screen.
Okay, oh, not sure. So, right.
Yes.
Okay, right, so let's go to here. So my name is Dr. Tampa. I'm a GP working in Essex and London. I've got a background in medical engineering. I did a graduate medicine course and then I did GP training. I've got over 10 years working in the NHS and in the private sector. So yeah, various different hats. Work as a GP partner, co-founder of Condada, and I advise an organization called Afro-Caribbean Medical Mentors. So the present danger at the moment, we've got SARS-CoV-2, which is responsible for the COVID-19 disease. Obviously, Fleury spoke about how it originated in Wuhan, China, and spread the suspected transmission. The zoonotic transmission was from a pangolin, which is a type of animal, to humans. And obviously, the World Health Organization declared a pandemic. And to date, there's over 80,000 deaths in the UK, 20 million deaths, 2 million deaths worldwide. In terms of death certificates, I'm happy to answer a question about that at the end. For the purposes of this, I'm just going to quickly run through where we're at. Concern with COVID-19 is obviously it spreads very quickly. It can take up to 14 days for symptoms to be seen, and people can be asymptomatic in the vast majority of cases. The problem is that 20% of people who get COVID become quite ill and they need to be supported. And that support can require ventilation or other things like oxygen. And you can see like what's happening in Brazil. They're running out of oxygen, and that's meaning that people are dying. And so the management of COVID is more about avoiding, so flattening the curve to some extent. Okay, that's just a picture of my oxygen saturations when I had COVID in April last year. So the other problem we have, apart from obviously the whole COVID infection, is also what's called an infodemic. So excess information, lots of social media posts, lots of videos being shared on WhatsApp with variable and questionable sort of information, pseudoscience, and that's leading to uncertainty and mistrust. People are scared, and that's entirely understandable. And I think the thing to understand is that people often they don't see the reality of the world. They see the reality of their own experience of the world. Okay, so in terms of another one of the reasons that we're so anxious and worried, because there's mixed messages from medical doctors. And I would say that often it's because the medical doctors aren't traditional medical doctors. They're alternative medicine, they're complementary medicine, they're other types of medicine which aren't, they don't follow the same practice, the same medical legal guidelines, the same medical ethics, and the same evidence base that traditional or conventional Western medicine follows. So in terms of Dr. Karim's intervention, everything works along with the law. So if things are not working with the law, then things cannot be sort of justified or defended, particularly when it comes to medicine. We can only practice because we work within the framework of our ethics and our legal sort of positions. Autonomy, beneficence, non-maleficence, justice, these are all aspects that govern the way doctors work. And in terms of the mixed messages, if you were to look at the institutions that sort of govern medicine in the UK, you know, even internationally, they are consistent in their messages and they've not sort of deviated and suggested anything else. Okay, so why is a vaccine needed? A vaccine is needed because we will have third and fourth, waves, and this may go on for another couple of years unless 80% of people develop immunity. And the way that can happen is if the disease or the infection is, 80% of the population catch COVID and they either survive or die, or the alternative is 80% develop some antibodies through vaccination. So those are the only real two ways that the COVID will sort of burn itself out. So if 80% of people have some degree of immunity, then there's no way that the virus can circulate. So unfortunately, what's happening is at the moment, less than 10% of the UK population apparently have had a COVID infection. And so over time, the numbers will keep on increasing until everyone has some level of immunity, or they've died. So it's difficult, but unfortunately, that's the situation we're in. And if things are allowed to continue, then the NHS will be overwhelmed, and other public services may be, they're at risk of collapsing. Obviously, there's a massive economic and psychological impact. Then there's the risk of social unrest and political instability, and obviously the concomitant super strains or resistance to treatments or vaccines that may develop. So obviously the pictures just show the different scenarios that have been modeled or calculated based on past experience with the 1918 flu pandemic that killed, that went on over 3 years. Okay, complications of COVID are very important as well. We can say, just let everyone have COVID. What's the big deal? The big deal is people over the age of 40, people who are Afro-Caribbean, people who are overweight, people who have diabetes and lung conditions are increased risks of developing the complications such as severe acute respiratory syndrome, thromboembolism. So COVID can provoke a stroke, it can provoke a heart attack, it can provoke all these complications which lead people to die. COVID equally can cause Guillain-Barré syndrome, it can cause Kawasaki syndrome, it can cause a multitude of syndromes, and it can also cause long COVID in people who are, who look well, but are essentially experiencing long-term symptoms related to chronic fatigue due to a COVID infection. Okay, so in terms of what a vaccine is, not everyone knows or understands, but a vaccine is essentially a way to train your immune system. You provoke a response in a safe manner to ensure that when you do come in contact with an infection, your body has the tools to fight off the infection. And when people travel even to Congo, we need to have a yellow fever vaccine. You need to travel to other parts of the world, you need to have Japanese encephalitis vaccines. That's because you may encounter a Japanese encephalitis, or you may encounter typhoid or yellow fever, and subsequently, if you don't have any means of protecting yourself, you become a burden, or you become unwell whilst on holiday, so you can't enjoy your holiday. So it's very important that we try and understand that vaccines are essentially, they're a tool in the toolbox to prevent illness and disease. Okay, there's lots of different types of vaccines that have been proposed for COVID-19 because there's lots of different approaches to making a vaccine. So, there's, different ways of showing your immune system what you have to fight before you fight it. So you can show the full vaccine, you can show the full virus, you can break up the virus and show a portion of the virus, or you can send an instruction to your body with an mRNA, which is messenger RNA. And these are all sort of, some are old technologies, some are slightly newer technologies. The mRNA vaccine is a newer technology, but it's based on scientific principles. It's based on, GCSE level science. So if you ask your 16-year-old about mRNA, they may be able to explain that to you. mRNA is essentially a page from a book of instructions of how to make something, and that something is a protein. So if we go back to our GCSE or A-level biology, we understand that the body is a system of systems. At different levels, you've got a cell, you've got a tissue, you've got an organ, you've got an organ system, then you've got an organism. In terms of a cell, in the cell, there's machinery that has different jobs, has different functions. And in the case of the main function of the body, which is to produce things and to remove things, a cell also has that job. And one of the machines in the body is a ribosome. A ribosome essentially is one of the components that the body uses to create proteins. And so it does this by reading RNA, which is sort of a type of protein that the body has in the liquid within the cell. And when the ribosome reads the mRNA, it creates a protein. So what happens is I would like to I ideally would have had a video, but unfortunately I've not got a video. Essentially, as the ribosome moves along the length of the RNA, it creates a chain of molecules. And as the ribosome goes from the beginning to the end, so it reads the page, which is the mRNA, it creates a chain which gets longer and longer and longer until it becomes a full protein. And that full protein is, in the case of the COVID-19 vaccination, that protein is the S protein, which is the spike protein produced or that is on the surface of the coronavirus. When you ask whether COVID vaccines can alter your DNA, we have to understand what a virus is and what the different viruses are that affect people, that are in nature. This picture, or this diagram in the middle, shows the different types of viruses that are available. You've got coronaviruses, you've got retroviruses, you've got adenoviruses. There's a multitude, there's hundreds of thousands of different viruses that can be, that are in humans, that are in animals, that are in plants, and they infect those organisms and they replicate. That's what they do. So in terms of affecting your DNA, the coronavirus doesn't have two enzymes that are needed and are found in retroviruses. So an example of a retrovirus is the HIV virus. That's a retrovirus. It has reverse transcriptase, which Fleury talked about, and it also has another enzyme called integrase. And we can talk about what an enzyme is and how it works, but essentially the machinery or the mechanism of the vaccine doesn't permit it to do what a retrovirus would do. And the vaccine from Moderna and Pfizer, which uses mRNA, doesn't, there isn't anything within the actual injection that would allow it to integrate its own RNA into your DNA. Okay, and just to touch on, gene therapy. Gene therapy is something that utilizes those enzymes, reverse transcriptase and integrase. But obviously for the purposes of the vaccine, it's nothing like gene therapy, which is a very expensive therapy, which scientists are developing to treat genetic diseases like sickle cell. In terms of the vaccine development and regulation, there's lots and lots of organizations, lots of laws, lots of acts of parliament, which regulate how vaccines and medicines in general are given a license to be administered and used. And so, people query, why is it so quick? How come, they've done so much in such a short space of time? I think you have to remember that we're in an unprecedented situation. It is a world pandemic. There's 350,000 or 300,000 people dying in the US. There's however many who are going to die here in the UK, and people are being affected in Brazil. And unfortunately, scientists have to have a solution. And one solution is to try and come up with a safe method of increasing the immunity that people have in a population to prevent the infection getting out of hand or getting any worse. So they do things instead of doing things in sequence, they do things in parallel. So that means they do things simultaneously. There's always a initial literature study, they check the initial science, and then they do an animal model. They look at the effects in an animal, typically primates or rats. And subsequently, once they're happy that there aren't any adverse effects in rats and macaques, rhesus monkeys, they then do small trials in small groups, say less than 100 people, then 100 people or so. And then in the case of the Pfizer vaccine, you're looking at 40,000 plus different people, different backgrounds, different ethnicities, different parts of the world, and then they collate that information to come up with a conclusion as to the efficacy and safety of the vaccine. Usually within a space of 2-3 months, they have enough information about the toxicity to determine, whether or not there's going to be any major side effects. And equally, you go back to the principle of, our understanding of science. So when you inject a protein into someone, that protein being a portion, so not the full viral RNA, but a portion of the viral RNA, you can determine, you should be able to determine what its effects are going to be. And if it's purely a portion for a spike protein and nothing else, why would you suspect that there will be problems or issues, other than, the initial effect of developing immunity? There shouldn't be. But scientists have studied this, they've looked into it, lots of different groups, and subsequently we've got over 80 different vaccines that are on their way, essentially.
Yeah, which is understandable because we, as professionals, it's a different view, but we have lay people, and some people were wondering, what's the difference really between the COVID vaccine and the flu vaccine, for instance? Because obviously people are looking at it in terms of the symptoms and all of that. And yeah, so that was one of the questions from the people in the audience.
Okay, so it depends which flu vaccine you're talking about, and it depends sort of who manufactured it. I've not looked at the flu vaccine to determine what type of vaccine it is, but if you look at the existing examples, you can see that we've got an MMR vaccine, which is a live attenuated vaccine. We've got polio vaccine, which is inactivated, and essentially there will be a type of COVID vaccination which will use each of the different possible ways of producing immunity. So there will be a COVID vaccine that uses the very same technology as the ones that they use for influenza. And there will be a COVID vaccination that uses new technology. But the one that's done by AstraZeneca, that's the one that's using the oldest technology around, which has been developed over the past 30 years. And essentially it's the same thing. All it does is show your body what it might fight in the future.
And is it possible for some people, to have a natural immunity against the virus?
Absolutely. So they say that in the population, they've done studies because, like Fleury said, we have had coronaviruses circulating for many years. Some people who have had previous infections due to a similar virus from the same family will already have some antibodies that are also effective against SARS-CoV-2. But not everyone will have that immunity. And so what we're seeing in terms of 60 to 80% of people having mild disease, it may be related to them having some mild level of previous exposure to similar viruses, or it may be that they're fit and well and young and they're not at risk. But Afro-Caribbeans, Asians, elderly people with pre-existing conditions, particularly people with lung diseases, will be at an increased risk. Okay, so the evidence from the research is very good. Moderna and Pfizer have similar levels efficacy in terms of sort of the number of people who end up falling ill. So instead of say 20% falling ill, you only end up with 5% falling ill. And in people who are elderly and people who've got existing conditions, that's it's very encouraging, because as you can imagine, as you get older, your chances of falling ill increase from 20%. They go up to 40% or higher. So if you're an older person over 75, there's a very high chance that if you catch COVID, that you will fall ill and need to be supported and potentially die. So instead of risking a 40% chance of death, you reduce that risk to say 5%. That's already a massive improvement. And so the likelihood of the NHS becoming overwhelmed is reduced, because the elderly, the people who are infirm, people who have multiple health problems are unlikely to become ill enough to require ventilation or support on ICU for several weeks. And in terms of what the UK government are doing, the American government, governments who have money, they've bought lots and lots and lots of vaccines well in advance of them becoming manufactured or becoming licensed, even because they're anticipating that they're going to need to have enough to vaccinate their population many times over. Like I said, from history, we know that the flu pandemic of 1918, it went on over 3 years. There were 3 waves, and people died in large numbers. And equally, if nothing is done, then the death rate is going to be even higher. Luckily, with lockdown and other measures, that can be mitigated. In terms of administration, the best performing country at the moment is Israel, but hopefully the UK will hopefully pick up on its only 4% vaccination to date. The other thing to finish on is not to scare anybody, but coronavirus or COVID-19 is only one of many, many, many viruses. Unless we get a better understanding of viruses and develop, solutions to these other illnesses, we're going to be at risk of further pandemics in the future. I'm sure we've heard of Ebola, but I'm not sure if anyone's heard of hantavirus. It's an even worse virus from China, which is likely to cause even more problems if it develops the same level of transmissibility.
Just one question, Dr.
Yes.
Sampa. Someone's asked, why does he say African and Asian people are more likely to get coronavirus?
It's a very good question. It's based on science. We know that coronavirus, the spike protein, or the bit that stands out, it sticks onto receptors. So if you've got a knowledge of biology, your body obviously is like I said, the cells of your body have receptors. The receptors are for hormones and for different molecules. One of the receptors on your cell, which is dependent on your genetics, is the ACE receptor. So ACE is a target for different chemicals, but essentially it's something that regulates your blood pressure and regulates other parts of your metabolism. We know that men have more ACE receptors than women, and we know that Afro-Caribbeans and Asians have more ACE receptors than white people. And so if you have more ACE receptors, then you're going to have a greater chance of the virus sticking and then injecting itself into your cells and subsequently replicating. And the more virus you have in your body, the greater the likelihood of disease. So it's just science. You can look it up. You can research ACE, ACE, and it's in terms of ACE, we often use it to treat high blood pressure. Okay. So I think it's worth understanding that it's not some conspiracy to make sure that Black people take vaccines or whatever. I've taken my vaccine already, but I need to take another vaccine. In terms of ACE, that's what I would say.
Okay, I see that we have a few more questions from the audience and people on Voice of Congo, but because we've got one more speaker, I think we'll go to her first, and then we'll try and answer the questions of the people in the audience and people who are sending their questions in to make it easy.
Cheers.
All right. So last but not least, just like Carol just said, thank you very much, Dr. Tampa. And so our next guest speaker is someone who probably, she's a public health specialist. And I've met her a couple of, maybe once. It was another event organized under the Jenner Costa event. We started with a lady. We're going to end as well with a lady. Whatever language she's comfortable speaking, I know she will probably want to speak in Lingala and English. And I love the way she just expressed herself in Lingala for some reason. And so without any further ado, I would like to ask Francine Mukwaya, who is a public health specialist. And I would like to know what advice would you give in order to reduce or prevent the spread of the virus? Ndeko Francine Mukwaya, à vous la parole.
Oh, merci beaucoup. Thank you so much. Really like this. But am I allowed to add it before I start? The question, there is one question they asked Dr. Pidange about why Black people, most of Afro-Caribbean and African people are getting coronavirus. Apart from what he said, I wanted to mention also economic. Economic is part of it because of we are in a level of compared to other community. I'm not gonna be. We are our poverty is part of it as well. Poverty played massive role compared to other communities. So it was important for me to mention that as well. Anyway, I'm gonna be mixing because I think prevention is very important because prevention is the one who stops the disease to spread out. So I'm gonna be mixing English and Lingala because I think consider ndenge batu bakufi ebele na community na biso, it looks like the level of prevention is very low. So it's so important for me to mix the both language. I have a background in psychology, and in psychology, it is so important to kind of speak the language, apart from English, speak the language people understand for them to be able to, to have it here. Because sometimes it's also overwhelmed to people, when we speak English, maybe some Congolese people or the African are watching English, maybe it's the fifth language. Majority of African people, English is their fifth language. We speak other languages, like I speak other languages. So it was so important for me I decided I'm gonna mix both languages. Prevention is, I'm gonna focus more on prevention. Prevention is a procedure through which individuals, particularly those with risk factor for disease, are treated in order to prevent a disease to spread out. It's really important in public health prevention, because prevention is that like disease epanzanate. Suppose when someone's got diarrhea, it's also an infection, and then you live with someone with diarrhea at home, and I've got diarrhea at home, you live with me. In a prevention, we can prevent that. And your brother and sister will not be able to get that diarrhea, because diarrhea is, as I say, is an infection. Omona batumsusu, omoni na famille, mutumoko azui typhoid, batubele bazu yango. Because of the level of prevention or Ebola, as we know, is very low. It's so important. So prevention is very important in public health. It's very important, as Dr. Pidange and all the speakers already spoke. It's so important in any health system, because it stopped any disease to spread out. So in when I decided I wanted to make it more informal for our people, so I look at how we behave, how our culture as Congolese, how we kind of behave, our culture and our system. Neti ba Congolais neto zalaka to uta na Congo to ye awa to sakoma, how we kind of behave. And then I made it to the mixing it and put it na sans gezala all together, kind of match out. So I came, apart from, we all know about, we have to wear masks, we have to wash our hands often and keep distance. But I think also, because maybe of this disease in the community, so I believe like people are still visiting families. in in secret. People are still doing it. And churches, people are still going on in the church, maybe pastors' prayers, they're going to veiller, the vision, whatever night veiller, the prayer, people are still doing it 3, 4, 5. Could you hear me?
Yes, yeah. We can. Yes, okay. We can.
So I feel like it's so important for our people to understand that, as other people already said, this disease, I really liked when you brought Francos, who is someone who had it, to actually give this testimony. It's so important for people to understand that this disease is really real. I work where I work, nazomona ba collègue misusu bazwi yango, heureusement nga nazwi yaki yango te, but na chikozo yango na ntepo na salaki ba test antibody and also every week to sala ba test weekly test as well. So you see people are having it, and then they'll propose bango 14 days of work. So it's so important na community na biso to comprendre que, yeah, I understand we have to pray. I understand I'm a Christian. I understand we have to do all stuff. I understand the culture na biso ke tozara toujours together, famille, cousin, cousine, tozo ke talana, blah, blah, blah. I understand all that. But I also want you to understand this disease doesn't have ezatena oyo soki ozwi yango, you are able to give a lot of people. You are able to give a lot of people. Suppose soki ozwi yango, okay na salon, neti okenda ba salon na biso ba Congolese something, okay na veiller a secret po ba Congolese bazo continue sala ba veiller ba secret wana. So to pray, and then when you go there, you need to think about people who also visit wana, they may be a high risk. Those people may be as a diabetic, maybe it's got all the all the chronic disease. We have a sickle cell. We have people who have a lot of disease, like you put them at high risk, and sooner they get it, they go there and they share it with all the people, and that's how we've been having a lot of people dying in our community. Nazana ba colleague or bazaba public care consultant, we study with them here in the University of Cambridge. They Sierra Leone, Kenya, they already started, they did it already. But like what we are doing now, which is I'm so happy for for organizing this, is so important. The basalaki deja prevention na community na bango. This is why you see the communities like Kenya, Nigeria, and so Bazana, the level of killing, people are dying is not much compared to us, because we are really, I don't know, I'm not gonna use a stubborn or something, but we need to understand it's so important. You can pray at home. Because that's when you do that, you're already putting prevention in practice, which is practically going to save a lot of people. Another thing is I want you to touch on nutrition. In public health, we talk about nutrition as well, because it's part of the prevention. I know we have to eat whatever we want. We have to be, people are not we can't impose people what to do, what to eat, but we need to remember also to be healthy. A couple of weeks ago, I was on phone with Dr. Pidan's wife. We were talking about the healthy and things like this. Eating healthy is so important. We need to start looking at biloko tozolia. I understand taba. I understand all these things. I really do. But we gonna have to have a healthy way of eating as well. I'm gonna give you a couple of I'm not gonna ask people to do they have to do it, but I'm gonna give you a couple of things that's in this condition we're passing, because in public health, nutrition is so important, and any infection, nutrition can protect you, because nutrition, when you eat healthy, it boosts your immune system. So this disease, if you are, I feel like I wasn't till now, even though I'm kind of in contact with people who had it, maybe because of my immune system. I'm not trying to show off, but I want our community to kind of make a way of change a little bit, eat a lot of food like fruit, vegetable. It's so important. Par exemple, épinard. We all know épinard, spinach, but depuis Congo is one of the vegetable or boost our immune system. It's very good. Fish, we need to eat fish. We need to eat practically healthy things. And I really want to ask you if it's possible for now, if we can be able to start using at least olive oil, like olive oil, sunflower oil. Those are very healthy oil. Vegetable oil is a little bit tricky. You can Google it, see, do a lot of research about it. You'll see why I'm saying that. So we have to reduce a lot how we eat, like how we process, like a processed food, bagel and things like that. Yeah, we can see it in, but in moderation. We really need to kind of look at our health and nuts, things like almond, things like all the sort of nuts, things like, if you don't like practically maybe brown bread, this is a very good brown rice. It's very good. And reduce also salt. I understand the salt and the sugar things. 4 luto ya sucre na tea. I understand all that, but sugar is a killer. It's gonna reduce your your level ya immune system na yo. So immune system is a little lower. I thought it was healthy. I definitely believe that on the témoignage ya brother Francos. Yeah, he's healthy. I know my brother is healthy, but I think his immune system probably was lower. I don't know how he eats a lot of, if he does eat a lot of sugar, if he does a lot of butter, margarine, kilo, and a white bread. I don't know. So when you eat a lot of things like that, it's unhealthy. You cause a physique, but you are making your immune system a little bit lower. And then with this disease, it's all about boosting your immune system. If your immune system is very good, like avocado, things like that, you're eating banana, it's gonna boost your immune system. The almond, there's all sort of nut, yebi. It's gonna help you a lot in terms of basically prevention as well, because prevention is also being able to eat healthy. And the last one I want to also touch on is when we visit I know we want to visit our mothers, our parents, and mom and dad, and all the family members. My family live in Manchester. I moved in Cambridge here to complete my master's and all those things I'm doing. Every year I go, almost every 2 months I go to see them, because I love my family. But I didn't go this year. The last time I saw them was in January 2020. That was the last time I saw them. So why? Because I didn't want to put them at risk. They are home, but me, I am in the forefront, kind of like key worker, Dr. Pidange and the rest. So na danger, because one of my sisters go as a hypertension or high blood pressure. So I don't want to put her at risk. I might be healthy. What about her? So that conscience, I have to spend my Christmas here, my New Year here, because I have to prevent that. I don't want to take it to Manchester. And as soon as my sisters also go, some Congolese friends, she's going to share it. And my other family, that's how we are sharing it. Let's talk about mapa. So it's really important for us to think about that when we taking a decision. The best way for us to be able to see our parents and stuff. I have a couple of friends, but my colleague, or your family bangozi bazana region, or the English and stuff. What they do, so kendo tell our parents bango, they're shopping or something, because I've seen them doing that. They drop it in front of the door, and then they wave their parents to the window. Mom, dad, they do that because they don't want to put them at risk. But we do it. I understand culture na be so, I understand it. But in this case, there's no anything to do with culture anymore. In this case, it's about protecting your loved one and protecting the community. Because soon as like in Manchester, a couple of people died in Manchester. They took it from the salon and they share it. And that's a coiffure, salon de coiffure. And that's how it went. Everybody, a couple of people died in Manchester because of, lack of, believing the disease exists. So we can do that. And we have to think about, we are lucky. Disease we have a lot of social media. You can still be in contact with your families. You have WhatsApp, you have a FaceTime, you have Instagram, you have Facebook or Signal. All this, you can see, call your parents, your sibling, I don't know, your cousin. You can see them through the video, Zoom, like we're doing now. You can see them. You don't have to kind of, but I understand it physically. I understand that, but you can see them using that. We are kind of like 100 years ago, there was this disease, what they call it, Spanish, whatever, I forgot the name again. Just think about at that time, how it was difficult because they didn't have what we have now. They didn't have.
Hello, Sister Francine, which is so true. The disease, the virus, est ponarate. Donc, on le bate parce que naza young, parce que naza fit. So it's very important to remember. Au cause à la young, mais peut-être dans l'entourage nayo, des konayo, pas parents nayo, baza penda healthy. Donc, ce cause you ango, you could be asymptomatic, meaning ozana ba symptômes te, mais au partager ango. Donc, it's very important to make the right choices. And like she's talking about nutrition, below to ponara kolia, et affecta abiso, et affecta ka health nabiso, because research so far est là ici que beaucoup de personnes qui sont affectées, bien qu'il y ait des personnes qui sont quand même en bonne santé, sont des personnes qui ont des problèmes de santé au départ. Donc déjà, tout ça, ça peut être affecté par ce que l'on mange, par notre manque d'activité physique. So it's very important to really know and to make the right choices, especially this present time.
Yeah, it's really important for her to think about. Think about your loved one, you love them, and protect them. Like people are like here, we say protect NHS. In this situation, I would say protect your loved one, and this by making a decision that you think you will protect not just your loved one, the community. Because as soon as I get it, for instance, I'm able to where I live, Bakongole Bazav, a lot. I can maybe count 2, 3, I don't know. But the city like, or the big city like London, Manchester, Manchester, I usually call it is actually Mujimai. Kind of like that. There's so many Congolese, we call it Mujimai. So if one Congolese get it, obviously the chance of a lot of Congolese be able to get it, it's easy like that. So I want people to be conscious about what they're doing, apart from wearing masks or washing your hands often and stuff. Also, you're keeping distance. Also, think about visiting. Think about prière. But visiting. Pass a prière 3-4 personnes. Yeah, think about it. We need to stop it. Also, think about your nutrition. Those 3 things are. I want you touching. In terms of prevention as a public health specialist. Thank you.
Thank you very much, Francine. Really and truly, this was really enlightening for a lot of us. A lot of information. Ne tolobaki pene bandeli, tokosala shomoko more Lingala and French focused because to yebike ba to ebele na communauté na biso, surtout ba parents na biso. Et bien, ils vont apprendre anglais. Donc, tout ça, pour ça, ils vont comprendre, ils vont se protéger. Donc, le bon anglais, c'est bien, mais ça n'atteint qu'un certain nombre de personnes. Mais tout ça, pour ça, la communauté, n'a pas mobimba penda, et ils vont se protéger. Na yebi que Fleury pe alinga ki abakisa, moi et l'eau, donc na otike l'autant au bakisa. Mais après ça, nous avons besoin, bateau, bazaki na ba question, tout qu'on share the questions, tout qu'on répondre en gros, parce que donc il faut totaler la payeur. Donc thank you very much. I'll let you speak, Floy.
Yeah, merci beaucoup Nakolo Banalingala, surtout pour nalingi na salama intervention na baxelo ko moko na question au batunaki docteur Pidange na likambuya pourquoi bazolo ba contamination et causa bon black people and Asian beaucoup catch facilement coronavirus na monaki Francine Nabaksaki P, docteur Francine Nabaksaki, quelque chose, il y a Kolobake, ceux qui population au boza so boza po boye ba ke boza na problème ya malnutrition. Donc toza na problème ya malnutrition makasi na ba communauté na biso po toyebi ko lia pe malamu te. Eza vraiment attaché na background na biso place ni touti. Et lisusu elo moko o to bosani koloba awa nzoto na biso eza na posa ya ba vitamine nyonso pona kozala ebo ya kozala na good immune system pe ko fight yango. Et moko ba vitamine o vraiment biso ba black people to zangaka o eza lelo very very important na coronavirus eza vitamine D, because vitamine D et salaka eza vraiment protéger biso makasi surtout na ba problème eza respiratoire. Donc vitamine D is very, very important in the way biso by black people, we can't get enough vitamin D in our system. This is because we know we have melanin, and melanin is vitamin D bazoango mingi na soleil, na the sun, and this melanin is blocking us to get enough vitamin D. And tant to yaka mboka o bamboka malili oyo to komi so even more deficient, but bele bakendaka et pas ba GP ba oyebisa bino parmi ba bilo minene o bakanga biso ba noir ezaratoza na problème à vitamine D. Donc lelo vitamine D is very very important na community na biso na ebite so Dr. Pidan ako talk about vitamin D. Even biso na ba hôpital lelo ba okaba yango ofele, surtout ba yebi ke toza na ba problème wana mutu mususu a préféré sombela mba ke eta mususu asomba kisi ya komela oyo kiko sunga e po parce que kolia na biso no eza malonga te tomela rapete ba multivitamine oyo ko sunga biso po toza na ba immune system ya makasi. Donc eza vraiment problème. Et na moni ndeko mususu rapidement pour na sukisa ndeko mususu atunaki likambo abi po nini so tozwi vaccin il faut ka to continuer kolata ba masque. Pour le moment eza very very important to continuer kolata ba masque po ata so zwi vaccin mais ingolo bateke okoki su te ko contract coronavirus okika kozala exposed to coronavirus teo ba ozala asymptomatic. The danger is as go now na batu oyo bazana vaccin te po parce que soki yo oza asymptomatic, you can still pass it on to other people, which is very dangerous to the people that we live in. And is important to continuer ko la ba mesure nyonso oyo gouvernement zo pesa is very important. Kolata ba masque, ko sukola maboko na biso, et puis distance makambo nyonso. Thank you so much.
Thank you very much. I wanted to see for people who have questions, if they could raise their hands so we can actually try and go to their question, because there have been so many questions so far and I've lost track. I know, Rudy, you had a few questions. Do you want to tell them? Do you want to ask? Has Rudy disappeared?
No, I think all my questions were answered through the chat. I can't think of any question at the moment.
Okay. I have a question that someone had asked me. Oh yeah, there's someone else, CKO. I'm going to let you speak in a minute, CKO. Well, it's about the immune system. I think someone who already had a weak immune system and had the first, had COVID on the first wave. And so they're worried that obviously, are they more likely, once again, to catch the virus if it was to, well, because we've got a second wave now, or is it the third wave? So are they still likely, even though they had COVID initially, to still have it? Because I know at one point, some people are thinking, if you already had the COVID, you're not likely to get it again. Dr. Pidange, do you have an answer to that at all?
Yeah, hello. Yeah, I think it depends. There's lots of different research from lots of different countries to say that the antibodies that you produce after recovering are going to be around for several months. Some research suggests that it can be around for several years, up to 17 years in some cases. So it just depends. But I've been speaking to other professionals by COVID 2 ou 3 fois. And sometimes you can have a mild infection the first time round, a more severe infection the second time round, or subsequently. It just depends. We're finding out about the disease because, like I said, it's a new type of coronavirus. So, you know, literally in the past 18 months, you know, we're finding out everything that we can about how it affects people.
Thank you very much for your answer. I'm going to let CKO ask the question that they had. And then I have one question for Francos, and then I think we're going to wrap up and summarize, really. CKO, do you want to ask your question?
Yes, so it's about the vaccine and the new variants. I don't know if somebody's already answered because I got disconnected, but I just wanted to know for the people that have already had the vaccine and then now there's new variants, so what will be happening? Would we be requiring another vaccine, or it's just a bit worrying in that sense? The vaccine is being offered, but then there's new variants. What are we to do?
Yeah, because I think a lot of people were saying, what was the point of having a vaccine that people created because of the first wave, and now we're seeing new strains? Are those vaccines going to be effective on those new strains?
Sure. Is that for me or?
Yeah, any of the doctors on the panel. As a nurse, I have my answer, but obviously I'm the host today and I'm not using my nursing cap. So yeah. Sure.
No, from what I've read and I've spoken to a few people, the recommendation is that the new strains shouldn't affect the vaccines. There's lots of different vaccines being produced, and they're all being produced essentially for the spike protein. If the spike protein changes, massively, it completely changes. That often takes lots of time. Then potentially the vaccines might not be effective, particularly the ones that are coming out, the Pfizer and the Moderna and the AstraZeneca. But it depends. Everything depends. But essentially, it would have to change massively. Like a large section of the spike protein would have to change, and the mechanism is that it attaches to the cell wall on the ACE receptor, which is the way it connects to your, because the cell isn't. The virus can't attach anywhere else apart from the receptor. So we have one receptor one, and then is an facility or quota. But if the mechanism changes, then I'm sure they'll find a different. They'll find one of the vaccines out of the 80 that are being developed that will be effective, because, like I said, there's so much research going into it. There's so much money that's been spent to try and find a solution, because it's affecting everybody. It's not just the UK. It's not just America. It's everyone that's being affected, really.
Okay, thank you. I know the question I had for Franco, someone asked, what treatment did you have? Did you do anything? Did you have any medication? Don't forget to unmute yourself to answer this question, Francos.
I had antibiotics and paracetamol. That's all I was taking. That's the only thing that I had access to. And apart from that, obviously, I was applying some Vicks into my lungs area. Every night, every day, I was taking some vitamin. I took some vitamin C and vitamin D and some zinc, I think. Yeah, that's what I was taking on the regular. And also I had some cough syrup that I was taking, because obviously the cough was so aggressive, and I had to take something in order to bring the aggressiveness of it down a bit. So I was taking some cough syrup that I was taking on every I think it was every 4 hours that I was taking. And I was doing the water we mixed with Vicks and stuff, the steaming thing that yeah, so that's what I was doing that twice a day. I was doing it twice a day, in the morning and the evening. I was doing that. What else did I do? Plenty of rest, eating a lot of fruits. That's all really.
Really hitting the vitamins in the right place from the right.
So yeah, so that was the stuff that I was doing on a regular, really. So it was nothing extra, because as I said, the NHS doesn't provide you with anything. They tell you, hey, lock yourself up for 10 days.
Yeah. Okay.
So that was what I was advised to do, lock myself up for 10 days. But fortunately, I had people in connection to help me with certain things. So yeah, that was it.
Thank you very much, Chris. I've got Terry's got a question, and then Maya, and then we'll have Sly's question as well. Terry, could you ask your question?
We can't hear you, Terry. Terry, turn on your microphone.
Sorry for that. Can you hear me now?
Yeah.
Yes. Thank you for let me speak. My questions. I've got 3 questions. My first question will be to all the specialists, doctors, seeing everyone here. Is that I heard, according to some research I've done as well, like whatever we do to prevent or to actually cure the virus, it's not really something that killing the virus. It's something that killing whatever the virus is bringing. For example, like Frank was just spoke, he had was coughing, fever, all these things. So basically, what you're trying to get or what you're trying to do is to prevent all these different type of illness coming to you. So my question is that the virus itself, does it kill directly the vaccine? Does it kill the virus or does it prevent other illness behind the virus? Because we know the virus is bringing different type of illness to you. Does it kill the virus? Does it kill the virus, the vaccination, or does it prevent other illness to happen to you? That's my first. The second question is that we spoke about I know Francine spoke about spinach and we spoke about exercise and eating, all these things. What's the relationship between how can you be affected when you drink alcohol? Because we know in our community a lot of people drink alcohol. When you drink alcohol, how can you be exposed to the virus? That's it.
Okay, thank you. Do we have anyone who wants to answer that?
Yeah.
Go on, Dr. Karim.
Yeah, first, even without being like a practicing medical doctor, a vaccine is not a cure. A vaccine prevents you from getting sick. Once you've acquired the virus and you're already ill, giving you a vaccine is absolutely pointless because it's not going to cure you. The reason why they're vaccinating people is to prevent them getting infected in the first place. So anything after that, everything you're describing as the symptoms and stuff, you're already ill anyway. So the vaccine, because the virus, so far, if we could kill a virus, we'll have already killed the AIDS virus and all these other viruses. So they develop vaccines just to prevent you catching the disease in the first place. Because once you have it, you will need a treatment. And currently there's no treatment. You'll be treating just symptoms, reducing the dizziness, reducing cough, reducing this, but the virus was gonna be there. It's just like flu. You get a vaccine to prevent you catching a flu. But once you have the flu, you can only drink water to try and flush it out of your system because, yes, you'll go over the counter and take all these medicines that make you feel better, but you're not killing the virus. The virus, you're not gonna kill it. So you need to prevent it. So the second part of the question was
alcohol.
Alcohol. I mean, there's a myth going around because you wash your hands to kill the virus. So why can't you drink alcohol? That sounds like a Trump philosophy. Trump was saying, since we can use Dettol and all the stuff to kill the virus, why can't we just drink it and kill it? Yeah, that's fine. I'm sure if you drink Dettol, you'll kill the virus and kill yourself in the process. So what was the point? Now, people trying to picture a virus like this blob just going down your throat and then you put your alcohol and go. Now, when you get infected, the virus goes in your body in different places. So when you drink alcohol, we know where alcohol goes. It's got one way to go down and in your stomach. It's not gonna reach everywhere that the virus is. So drinking alcohol or anything else is not gonna kill the virus. Otherwise, it'll be so simple, we'll have gotten rid of it by now. So that is just an urban myth. And Trump did his best actually to propagate that stupid idea, like you could drink anything and kill the virus. But seriously, that should not be contemplated. Just wear your mask, wash your hands and keep the distance. The only way you're gonna stop yourself, if you're not vaccinated, just follow the measures wash your hands, wear your mask, keep the distance. We all know the slogan now, but that's the only way you're going to keep yourself safe, because there's nothing else apart from the vaccine.
Thanks for your answer. I'm going to let Mia ask her next question. Maya, sorry.
Hi guys. First, I just want to say it's really great to have all the professionals here giving advice, because I think something from like a civilian perspective is the kind of information that you guys get to study day in, day out. The normal person just don't know. They don't know this kind of information. They're going to rely heavily on the internet and TV, you know. So for instance, the food we eat, no one's telling us that it's unhealthy. We just get sold it from a commercial perspective. So we know that the economy and capitalism has had a very big push in the way that our government, or the way that we've dealt with the virus as well, which I think is something that hasn't really been picked up on much. It is driving a lot of whether it's driving a lot of deaths or it's having a big impact on this current situation. There was a comment that I think Dr. Karim made in response to someone, basically saying, I know things were confusing, but I'll, you know, listen to health practitioners rather than the government. Whereas Dr. Tampa was like, you know, listen, like follow the legislation. And I think that's a perfect example of the kind of information that from a civilian perspective, you will be receiving kind of contradictory sort of information, which then leaves you to rely on your kind of common sense, if that makes sense, right? And I think someone said this earlier, that based on, you know, whatever your reality is or whatever you perceive is kind of the information you take in. So correct me if I'm wrong, guys, but I'm guessing the legislations that kind of get put out are from the government, or, you know, they're sanctified by the government, which you as a, you know, a practitioner professional has to follow. So even if you have your own mindset about whatever something may be, or whatever your ideas or theories may be, you have to follow a certain way of doing things, right? So when you do that, we have to kind of rely on you and how you do things. And this is kind of why we're seeing that we're being failed by our health system, but not necessarily the health system, because they'll be like, we don't have the equipment or some of the things that our government is supposed to be providing for us. So we have this loop of pointed fingers that kind of go round, and we don't know who's to blame or who isn't. But in the midst of it all, a lot of people are dying and a lot of people are affected. So this is adding to what we are now calling conspiracy theories and so forth. And I think the problem I have with that is that because of how poorly our personal government has been handling things, and because of, for the first time personally, I've seen professionals having completely different theories that are clashing with the government, clashing with each other, and it's such a confusing time. And you're at a position where you're looking up to the leading professionals to give you the kind of information you need. Because of all of that, people then are looking for ways of understanding what they need to understand. And that's being called conspiracy theories. Whereas a government that we are supposed to kind of have a lot of trust and kind of, you know, we rely on how they do things, they have been able to do so many questionable things that we just have to wake up tomorrow and agree to, wake up tomorrow and agree to, and it's having a lot of impact on, especially the community. And because that's the Black community, we are kind of targeted in lots of different ways. You're kind of stuck between not trusting what the government is telling you to do, and quote unquote professionals, because they have to follow what the government say, and then being sandwiched in doing some things out of desperation or fear. So what kind of advice would you give to the usual people that don't have this level of access to information that you may have every day? Like, what kind of advice would you say in terms of following the right procedures? This is to kind of all the professionals, to be fair.
Okay, I have to clarify one thing. When I was replying on the text messages, I said, listen to health professionals, not the government, simply because, as you pointed out, from the outset, when we had the outbreak of the pandemic, the government advice was shifting constantly. This is understandable because this was a new virus. They didn't understand it. And in the finally, they start following their own medical advice. They will start listening to scientific advice. So what you have to understand is a difference between the political message and the medical message. The government, the politicians, you understand? So they need to spin things. They don't want to scare people. They don't. So sometimes that's why the message becomes confusing. But the scientific community is being consistent. They said, we know it's a virus. We're trying to isolate it. We're going to try and develop a vaccine, and they've been following that. Now, the government is made up of different departments. So you have the health department, you have this department, so everyone. So for instance, the school minister will want the schools to be open. They ask him why. Or without thinking or asking the guys from the health department, say, oh, because children are not gonna catch it. What is he basing now on, okay? Nothing says kids are immune to COVID. They might not be catching it or they might not be displaying the symptoms, but they're still human beings just like you and me, so they can still catch it. So that message is wrong. So people just, oh, I've got kids at home, they're fine, they can't catch COVID. That's not true. So then you get the health minister trying to scare people into say, everybody stays at home, don't talk to anyone. Okay, how long should you be apart? 1 meter, no, 2 meters, 3 meters. Wear masks. Remember when it started in March, no one was wearing masks. The government said, no, mask is not necessary, and this and that. And then they changed. So that's why I said the government keeps on shifting its position, whereas health professionals, the message is still being consistent. You see, when you're using the word legislation,
you said that the health professionals are given consistent. I doubt that would be correct if it's something that the health departments are still trying to figure out what it is in the first place. So I could understand if you said, you know, there are a lot of things that we are developing as we go along, hence why things will change. But the consistency is hard to kind of agree with when we've seen that. I mean, the government, they are making up a lot of their things on their own, but they are having to take, you know, health advice as well.
I'm going to answer that question, Maya. So far, you've got the scientists, you've got the government, you've got different agendas. No, the governments have not always followed what the scientists have said. Exactly. They do it at the end when they don't have a choice. But initially, they have their advisors, but they are looking at it in their political ways and economical. As a health, I'm putting back my health professional cap right now, and I'm telling you, that's the reason why there's been so much confusion. It's not because the science has not been saying one thing, it's because the leaders have not always listened. They've listened, they heard the science, but they've not always listened. And at the end, when they realized that there was nothing they could do, that's when they listened to the science. Hence the confusion.
That's correct. Because, oh, sorry.
Yeah, sorry. I apologize if I have to cut you short, Dr. Karim Chibangu, and also Maya. But we have to come to the conclusion of the event, and I would like to thank all of our guest speakers and everyone who's been attending via Voice of Congo and also via Facebook page. So the Congolese Action Youth Platform, the COVID-19 in the Congolese community of the UK. So we have indebted to your contributions to Dr. Pédange Tampa for the information that we received. For those who have asked and give us the emails, would like to know more about the information that we received tonight, they will be able to get so. Also, we'd like to thank Francine Mukwaya for participation and conversation as well. Fleury Litoki, Dr. Karim Prince Chibangu, and also the testimonial of Francos Chipuki. Thank you for your participation as well. And obviously to you, Maya Oja, thank you very much for taking part of this conversation. I also have to remind people that there will be another one that will be in French and Lingala, and we'll have different guests so we can reach out to all of our communities. And this one was I learned a lot, and thank you, and I'm sure everyone else who's been on here listen, whether it's via Voice of Congo or the Facebook page, we're able to gather and enjoy it. So thank you to everyone, and also to our guests and everyone who tuned in. Until next time, God bless you.
Please say in French as well, for those who are people
Merci et
Voice of Congo. Yeah.
voilà, donc voilà, c'est que je vais juste rapidement dire à tout le monde, c'est que merci d'avoir participé à cette conversation sur le Covid-19 dans la communauté congolaise de l'Angleterre. Donc, merci na Dr. Pidange Tempa, merci na Sœur Nabiso, Francine Mukwaya, merci aussi à Fleury Litoki, merci na Dr. Karim, merci na Ndekonabiso Francos Nchipuki, et aussi merci na activiste Nabiso Maya Odia. Donc, autorisation na réunion, bon, réunion, je préfère dire conversation sur Zoom, on y a en français na lingala. Pour bande qu'on a besoin de participer à yoka il y a des lois qui plus d'anglais évidemment tout va en Angleterre donc anglais c'est la langue principale mais aussi la communauté nabiso pour la koyoka pour la kolanda donc merci encore et à la prochaine tango et coquille tout ça au moins 2 heures donc tu se faut respecter peut-être tu n'as pas invité nabiso p tout continuer. Donc voilà, merci. Merci Carole, merci à tout le monde et bonsoir. Stay safe.